So focusing on what sort of teaching that you actually will be getting. There's an array of teaching, and depending on which hospitals that you go to, but in principles, you're going to get things like bedside teaching, and that's the key. Absorbing a lot from ward rounds. So I'll have, students coming around and my ward rounds and sort of learning from those ward rounds. And they're usually daily senior clinician ward rounds, say consultant ward rounds. You tend to have things like problem-based learning, depending on which trust that you're on. You may have things like team-based learning, case-based discussional learning as well. There are didactic lectures as well that is part of the teaching. A lot of our hospitals that we've linked up with do what we call simulation training. It's great. It's like they're using dummies, if that's the right word to use, and they'll have scenarios and cases associated with them. So all really great stuff that actually happens. Just to give you a bit of a feel for what is a general weekly timetable, but the other key thing is a student is usually linked up with a junior doctor. That's the best part of learning, because not only do you get involved in day-to-day stuff, like how do you fill in a drug chart, how do you put in a line, how do you put in a catheter, you're seeing how do you go to a radiologist and request forms. You get to do all of that stuff, what you would be doing day to day. But what you'd also get to do is go and see a patient and then review the patient and then come back and present it to the junior doctors. So you're exposed all the time to patients and what I call pathology on the wards. So it's what you make of it. The more you stay on the wards, the more you will gain out of it. The key thing with our program is you have to be doing 40 hours a week. But then there is also assessments, by the way. So you will be having things like what we call formative and summative assessments as well. So summative assessments, depending on which hospital that you're linked to, you may have OSCE examinations, which are seeing patients and then presenting those patients, or you may actually have some written form of assessments as well. We've got a huge footprint now. We're building up our footprint with different organ trusts in the country, both in the United States and in the United Kingdom.